here's the thing. In the United States, we're an inflamed nation. Okay, we're a nation of chronic disease. That is us to a T. But there are 3 chronic diseases that actually have the highest morbidity rate in the world. So these lead to the highest amount of deaths, fatalities, these chronic diseases. Okay, and they can actually be counteracted and prevented with some very basic and simple nutrient recommendations and steps, and also some herbals.
So what are the three? What are the 3? Let's just go through that real quick.
So the chronic diseases that we want to address today are diabetes. Okay, it's a chronic disease, chronic ailment, and then heart disease, and the last one's obesity.
We've heard of all of those. I'm Nick, the Curious Patient here. We just capped off 2024 here, the Be Well Now podcast with Dr. Ron Dummar. How are we doing, sir?
Great. We're here to save lives in 2025. That's what we're doing.
Exactly. And you said, a quick Google search, what are the worst chronic diseases? I mean, you see patients every day, but we were looking for kind of something we could find in the headline or, kind of the top 3 and then dive into your knowledge base in terms of what you want to
wanted to
share
know
with the people.
What are the big hitters, right? What are the great concerns, right?
So what is like the number 1?
The number 1 right now is diabetes.
I feel like everybody has diabetes that I talk to, I'm pre-diabetic or I'm diabetic, and it almost seems like an offhanded thing, and I'm managing it, or insulin, or I've got a glucose monitor. But even I was pre-diabetic when I first started working with you. Mm-hmm. I couldn't go a few hours without eating. I thought hangry was a badge of honor, in its own kind of funny way. And it's like, oh, there's way more to this than that.
Exactly.
And we went through a whole protocol. And so I can say that, like, there's a way to, you're on that precipice, that edge, and there's a way to walk that back, isn't there?
Oh, absolutely. There's a way to walk that back. And first of all, you have to identify it, and you have to acknowledge that you may have it. And that can be hard for some people, but you have to do a test.
Okay.
First of all, symptoms, and you mentioned some of them, like cravings, feeling hangry. If you have to eat frequently, or if you get really upset or irritable when you haven't eaten, or even if you feel dizziness, right, after not eating for a while. If you try to attempt a fast, fasting's super popular right now, so if you try to attempt a fast and you're not able to accomplish that, or it's super difficult for you to do, the likelihood is you are probably pre-diabetic, if not diabetic already.
Which there could be very healthy looking people who don't look obese or whatever, who are walking around with these conditions.
Correct, because really what the diabetic condition means is that there's some disruption in the pancreas. The pancreas, the beta cells of the pancreas, are no longer producing insulin, right? Or they're overproducing, or there's a disruption in the production of insulin in the body. Okay. And so that's what leads to the problems with blood sugar regulation. Insulin is designed to push sugar into the cell. So if you don't have enough insulin produced because there's an inflammatory condition in the pancreas, pancreatitis, or if you've even got an infection that's causing problems in the pancreas and affecting the cells of the pancreas, it's going to prevent your body from being able to regulate blood sugar. You won't be able to get the sugar into the blood, and therefore what's going to happen is you'll feel fatigue, lethargy, feel tired, you'll eat, and then you'll need to eat more and more and more because your body's not even able to feed itself at the cellular level.
So we've got diabetes. We've got the idea how to prevent it. There's some herbs you want to talk about. Who do you want to talk to? Someone who has diabetes, someone who wants to prevent it? Like what's the most effective way to communicate at this point of the podcast in terms of
the people that we talk to, the people that are listening to my podcast, typically they're proactive. They're the type of individuals that are saying, I want to do something about my health now. Okay. And that's who we want. That's who I want to teach. That's who I want to give them the tools to say, you know what, you can put this in your this quiver, this arrow in your quiver. And that's what we want to do, is give you those tools. So one thing that you can do for blood sugar that I love, it's a very simple thing. It's called berberine, right? It's bitter. Even think about bitter type foods that tend to be on the bitter side as opposed to on the sweet side. Think about the foods that you eat. If you're constantly needing sweet, and things just taste horrible to you if they're not super sugary, then it's very likely you have a blood sugar issue. So it would be very beneficial for you to begin to start including some of those more bitter foods in your diet. So these are things like greens, dandelion greens, Even cucumbers can be very, very beneficial for you to begin to introduce into your diet. Even doing something or on the sour side, like go for a variety of different flavors, but apple cider vinegar is going to help with your blood sugar a lot. It's going to help your body regulate the sugar that it needs to do and support the cell.
So you recommend what for folks if they're worried about type 2 diabetes? You mentioned a couple, I think bitter melon, cinnamon was on the list as well.
Yep, cinnamon's on the list. One thing about cinnamon is it helps reduce your insulin resistance, your likelihood of developing insulin resistance. Bitter melon also does that.
I've never heard of bitter melon. I've heard of cinnamon, as a supplement.
So bitter melon's actually, you can find it in a variety of different stores, grocery stores. It's more of a specialty item in our culture. In East Asia, they would have it very regularly in like saute dishes and things like that. So you can eat it and saute it just like you would any other vegetable. But it is very, very beneficial for insulin resistance or the development of insulin resistance. And essentially what that means is the cell becomes inflamed or irritated because there's been so much insulin secreted by the pancreas that it's like over poked the bear, right? It's bothered it so many times that eventually it just says, hey, hold on, we're not going to be receiving you anymore because we're overwhelmed. And so then the sugar isn't able to get into the cell because the insulin is actually what unlocks the key to open the door to let sugar in. And so now your cells actually become insulin resistant. So that's one of the issues that can cause a problem for patients with blood sugar regulation issues. So bitter melon, cinnamon, apple cider vinegar, I think that's good for diabetes patients.
And if there's a diabetic patient out there who is on whatever one gets prescribed, if one has
for sure.
diabetes, do you have any advice to someone who's just a diabetic and they've just like labeled themselves that and maybe they are that for life? I don't know enough about it, but like any advice to that person out there?
So for sure, there are absolutely herbal options for you. You definitely want to take and make sure you're following the advice of your care provider. Have a trusted care provider whose opinion you know well and that you trust. And then ask them the questions if that's an option for you to be able to utilize some of these herbal options, right? Mm-hmm. Or sometimes herbs will actually make your body perform way better than it otherwise would. And so some of your medications that you're taking might all of a sudden, just like we've talked about in the past, bioenhancers, these herbals will enhance your biology, therefore perhaps making the medication act more strongly upon your body. So you want to make sure that you notify your care provider if you're going to be taking or trying any of these.
That's one thing you talk about a lot, how individual every person's health is. And I always want that plug and play. Give me the three things, the top three. And that's the way you package something in communications. But health is so unique per person. So you're really recommending get to a healthcare provider, get your
blood work, check things out.
This is important, right?
See where you are. We're looking for optimization.
How important is getting the blood work just to know where you stand?
I personally think it's critical. There are a lot of patients, especially in the past, that have gotten away and been perfectly healthy, sure, following basic health principles. And if you can follow basic health principles and avoid the toxins and the flavorings and the dyes and the additives and the chemicals that are all over in our food that we know are in our food, and if you can avoid that, then you're going to actually be relatively healthy. The body's going to respond quite well, and it really can be quite resilient and recover quite well when it's just given basic proper nutrients. But what the blood test does, and we have such great technology, it's advancing so quickly. So why not take advantage of the technology that we have and see what's in your blood, see what you might be missing. You might have some nutrient deficiencies, right? You might have some imbalances or some deficiencies of the organs themselves, the way they're functioning. And then we can support that with either herbals or vitamins, minerals, nutrients. So find out optimization. Find out how far away from optimal you are.
And then with your trusted healthcare provider, work on a strategy. So if I have type 2 diabetes, is that game over?
No, not at all. Especially type 2. Type 2 diabetes. Again, we're talking about lifestyle. A lot of these have lifestyle solutions. These are chronic diseases. They're some of the leading causes of death in the world. And the solutions to them are actually lifestyle changes, diet, and some of these herbals that we'll be talking about today.
Let's talk about heart health. Heart disease is a huge killer.
Heart disease is actually the number one, the leading cause of death in the world. That is the number one cause. And so addressing heart and heart health and even hypertension. You think of hypertension itself, that word is actually fairly descriptive. And I think it's a good word because it's tension and hyper. Hyper is up, beyond, above, extreme, right? And tension. I think we know what tension is, right? It's increased pressure on, right? Or applying more load to. So we have this increased tension. So a high amount of tension, and it's affecting, we're saying this term in reference to the cardiovascular system. So we're referring to the amount of strain that's placed on the vessels and the heart itself. Okay.
So some strain is good, right?
Oh, absolutely.
Exercise, but
yeah, you got to get your heart rate up.
Yeah. Right? I'm just trying to figure out what is the strain being caused from.
Well, you bring such a good point up, right? Some strain is good. And if you're lifting and you're exercising and it's like, okay, let's do 3 reps of biceps curls, right? And you just keep going. And how many am I doing? 3 reps, how many? Oh, I don't know. Just keep going. And if you did just keep going and keep going and keep going and keep going, eventually the tension and the load on that is going to become way too much for you to bear. You end up with tendon and ligament and muscle diseases, right? Tendinosis. You have problems in your muscles and tendons. It's the same thing with your heart. If we keep the tension level of the cardiovascular system and the heart at a high enough level over a long enough period of time, we're not going to be able to properly heal and recover like we should. But we can take the heart and the cardiovascular system through significant amounts of elevated heart rate, through lots of tension, as long as it's in moments and we are able to recover.
Okay, so what are some supplements that can help?
Well, hawthorn's one of the supplements I really like. It's a very, very good. Yeah, the hawthorn berry. It will improve your circulation. It lowers your blood pressure. It literally can help strengthen the musculature of the heart. And as well, you have angiotensin, you have hormones that are released from your adrenals and your kidney. And essentially what that will do is it will allow or signal the vessels themselves to constrict or to dilate, right? And so that's actually it requires a muscular tension to constrict, right? So if the vessel is constricting, what's going to happen to your blood pressure? It's going to go up because there's extra tension in the vessels at that moment. So if we can allow that to actually dilate as well and relax, then the blood pressure goes down. So when we work with patients and we're talking about heart health, it's actually not entirely food. There's also a stress component. There's a neurological component to it. There is a mental component to it, right? There's a psychosocial component to it. So there's a lot of different aspects of heart disease that we have to address so we can address the whole person ultimately.
Okay, so we got hawthorn berry, omega-3 fatty acids as well.
Yeah, omega-3 fatty acids. Well, the thing about omega-3 fatty acids is it's really good for improving the vascular function itself. It's like supports the wall, the vascular wall. Your body makes cholesterol. And one of the reasons it makes cholesterol, we look at that as kind of a fatty material that it makes. One of the reasons it makes cholesterol is to actually heal the tissue of the vessels. So if you have inflammation in your vasculature, which is the beginnings of heart disease, you have inflammation, it will cause, just like you might have a sore on your lip or gum or teeth, mouth, you can get like a sore on your vessel, right? And if it starts to deteriorate that wall of the vessel, then you can have, the body will have a mechanism for trying to repair it and heal it. Well, the liver will actually produce cholesterol to pack that in and heal it. It's like the scab of the cardiovascular system. Okay? And if we have too much of that inflammation occurring and too many of those sores happening, and then we have so much of the cholesterol packing on repeatedly, what eventually happens is fatty plaquing, where we have calcium, it attracts calcium, and then it starts to obstruct the vasculature itself, the vessel, and that's when we can develop like heart attacks and things like that. So taking omega-3 fatty acids, which is fascinating. This is a fat. Taking a fat is actually going to help benefit your body, your vascular system. It's going to help heal the vessels.
All right. And then
coenzyme Q10.
Coenzyme Q10, CoQ10. Heard of that?
Yeah, CoQ10. It's a great one for the brain. I love to use it for brain health, for nerve health. It's also really good for the heart and for the cardiovascular system. It's powerful, super powerful antioxidant. And again, it helps to reduce your blood pressure. It helps take the stress off of the vascular system, and ultimately allows your body to function appropriately with reduced stress on the heart.
So if you have that plaque building up, is there a way for it to go away, or is it just permanent?
Yes, there is a way for it to go away. And these are some of the things that you want to do. Your body, just like a scab, your body will, eventually the scab will fall off and the body heals, right? That's what's supposed to happen in the vessel as well. So it really depends on how much inflammation is current within the blood. So if we can find these markers out, these inflammatory markers out by taking your blood, right? We draw your blood, we see what are your levels of inflammation. We recently just had a patient whose C-reactive protein, which is an indicator of inflammation in the heart muscle and cardiovascular muscle itself, supposed to be between 1 and 3, ideally, and even lower than 1 is really considered ideal. It was at 18. And so then we had to put him on a program, a protocol, and 4 weeks later, it was 4 weeks later, we did a protocol for 4 weeks. We redrew, and he was at 1.3.
Wow.
So that, when you're at an 18, a C-reactive protein, that's potential heart attack, potential stroke, right? Because the level of inflammation, the level of tissue breakdown occurring at the heart and cardiovascular system is high. Something's causing that.
So how many people get into your office versus don't? Like, how many people out there don't know that level is 18 because they didn't spend the money on the blood test and getting, a functional medicine doctor to look at, if they're going through a different approach, are they going to get a different diagnosis, or are they going to get pills for that? Or, what's your protocol looking like versus what someone might get somewhere else? Or maybe they don't even know they have that level, right?
So my protocol, first of all, you've got to check. You won't know unless you check, but oftentimes people will feel symptoms. They'll start to feel something or feel something's off. And all of these things it's your body communicating to you. It's so paramount that people understand when you don't feel well, if you feel a pain, if you feel an ache, if you feel a problem, it's your body communicating to you that something needs to be addressed. Okay? So when I lift, again, we're talking about lifting weights here, right? When I lift weights and I get sore, well, that's my body communicating to me. Well, what do I need to do? Well, I need to care for that. Well, how do I care for it? Well, I need to do more than I've been doing. So I probably need to increase my amount of antioxidants, right? I need to increase the anti-inflammatory herbals. I need to increase my my amino acids, my protein. So I need to make sure that I'm getting all of the nutrients to those muscles and tendons so that they can have the proper things they need in order to repair. And so the same thing with a pain, a headache, a migraine. All of these things are sending signals, your body telling you, hey, we need to fix something. So if you're having any of these chronic related issues, even if it's not diabetes or heart disease, but it might even just be, man, I get chronic migraines, or every now and then I get this sinus infection, or I think I've had a lung infection, 4 times this year. So people, if you've been on antibiotics multiple times in a year, it's probably a really good time for you to start coming into us and finding potentially other options that can help support you in your health journey.
Because if you don't have your health, what do you have, right? That's, you can power through a lot of things.
Yeah.
But you're saying those aren't worth ignoring to power through?
Right. It's not, what I'm saying is your body can take a lot if you're properly supporting it. But you don't even know if you're properly supporting it. You just ignore it and go forward, right? It's like we say it all the time, treat yourself like you're a high-end race car. Well, it's like, how many of you never fill up that high-end race car with gas or, whatever? We don't need to put oil in it, right? not only would you put the oil and put the gas in the high-end race car, but you're going to put the highest quality oil and the oil that you think is the most specific to its needs. Well, let's find the one that's most specific to your needs, right? Let's find the nutrients that are most specific to you and then give that to you. I mean, you shared a story with us once before about, I think, doing someone's program, and then it required ingesting a lot of cruciferous vegetables and things like that.
Oh yeah, I did the Brian Johnson Don't Die protocol where he has this like veggie bowl, and it was fascinating because it was like black lentils and broccoli and shiitake mushrooms and like a tablespoon of cumin, which I actually really like the cumin. Yeah. I loved getting all those.
It's a delicious flavor.
Yeah, and I feel like it's real healthy for you.
It absolutely is.
And you chop up a clove or two of garlic and you put some apple cider vinegar in there, like a lot of healthy, olive oil, and boy, is it an interesting meal to eat, but like the gas and the discomfort, and I was getting weird migraines because I don't think I was digesting it well enough. Anyway, that's probably not
for you.
The meal for me. I wanted it to be so bad. Like I told you, just shoot the standard operating procedure into my veins, just give me something. And Brian Johnson's, he has a Netflix special about him, so he's famous now. But
and he's fantastic. And it's cool that he's dedicated his body and his life to science, and he's contributing to our knowledge and understanding of health and nutrition, right? The importance of that. And really what it's telling us is, for me as a functional medicine doctor, it tells me Brian Johnson is touching for everybody. Hopefully we're finding this out from what he's doing. He should be telling everybody we need individuality in health, because that's what he's done.
It's just complicated and expensive, isn't it, to have everybody go in and get their blood tests?
Well, and then what did he say? Like $2 million a year or something?
Yeah, exactly. But so many things in life cost money, and you get what you pay for sometimes. And what more valuable thing is there than your well-being, right?
Mm-hmm. Absolutely.
Take care of yourself and you can take care of others, I feel like. So anyway, obesity. That's a big one. That's very complicated.
Yeah.
It is, right? It's not just simple. It's not just like don't eat fast food, or is it that simple?
No. Again, there's a lot of mental things that are wrapped up in obesity as well.
Yeah.
There's past trauma. Sometimes the way people were treated as a child at school, social interactions. In fact, a gentleman that I know, when he was really young, he was kind of chubby and pudgy, and it didn't really always feel like he fit in. But eventually he got into weightlifting, got into powerlifting, and then he did incredibly well, became very successful in that, and now he runs a gym. And loves it. And he's just the brightest, most wonderful human being you would ever meet, right? He's a fantastic individual, very smart, and great. But again, his backstory for him was a lot of his life was lived in kind of this pudgy, fluffy, and a little bit of shame. And he had to move through that. So that is part of what we have to move through when we're talking about obesity. And it's not about shaming anyone. It's really about taking little steps, little by little, choosing to do things that are going to benefit your health. And each of those little increments, each of those little steps that you take are going to be monumental as you lay that foundation and keep it consistent. Now, if it's yo-yo, and you're going back and forth, we're going to have to correct that trend, because what we need is consistency moving forward. The more consistent we can be, the more we can be altering the ultimate destination ahead.
Yeah. Consistency feels like a big deal to me in health.
Yeah. Yeah.
Like
it is. And it's not.
I just had New Year's, right?
Right.
And like, I don't drink, but like I eat a lot of bad foods. We sit here on this podcast, we talk about all the healthy things. I was eating Ritz crackers with hydrogenated oil, chocolate poured over it. Oh, I had sugar cookies. I had mystery poke from someone's thing, and then some weird dip, and then some chips that were made with, seed oils.
You went off the wagon, Nick.
I went off the wagon, and I'm happy about it, because I was like, it's not what you do between Christmas and New Year's. It's what you do between New Year's and Christmas. That's right. Is what I was talking about with my cousin. It was like, it's just, to me, it seems like, what are you doing most of the time?
Correct. Yeah.
I don't know. Maybe that's like a little cop-out.
Consistency.
I've tried all the methods. I've tried stark austerity and zero of anything and cutting out this and quitting that. And right now I'm more in like the flavors of life. You know, I'm feeling kind of like, what can I not judge myself for?
Sure.
Sometimes, and then do the other stuff right most of the time. I don't know.
Well, what we don't want it to be is a prison sentence.
What? Anything?
Whatever diet you're trying to maintain.
Okay.
Whatever your no is that you just can't handle, forget about it. Like, don't say no anymore. So, and I'm not saying you should say yes. What I'm saying is it's not a prison sentence. No one's forcing you not to do it. So own the fact that you're the chooser. You're the one who gets to make the decisions. You're in the driver's seat. Take responsibility. And then all of a sudden you can say, I choose what?
You know, what's interesting is like sitting practice, the meditation. Sometimes, like recently, some thoughts have come up because I'm feeling pretty all over the place and I'm just forcing myself to sit.
Yeah.
And one thing, two little mantras have come up that just kind of, I don't know where they come from, right? But that's the mystery of meditation. One is like, this moment is enough.
Yes.
Because boy, do sometimes I want the easy button or to run away or to do something else, the screen, This moment is enough. And the other one is like, I choose to be here.
Yes.
Right? Because I'm the one who's sitting down. And so if I could say like, I choose to be here, I don't know, those are like interesting things. You're making the choice, you know? Yeah. But anyway, that was it.
But as soon as you are making the choice, you have the power. It's a powerful position to be in, right? But if you're acting on impulse, if you're acting on a craving, you've handed over your power to something else, right?
That's interesting.
So, and I'm not saying you shouldn't ever act on a craving. I'm just saying when you do, you damn well make sure you choose to act on that craving.
And the craving didn't.
The craving's not choosing you.
Okay.
Right?
So mindfully approaching it.
Or everyone's going to have cravings. But the better you can be at either choosing to or choosing not, then you're going to step into your power because you have to take responsibility for that choice. This is my choice. I'm the one choosing to do this, not just like, well, I can't handle it. I can't because I have these cravings, or I can't fast anymore. I can't do this. Well, because of this, my body just won't. No. It's not about that. It's about you choosing, right? You have to step in and take responsibility for where you are right now, like you said. And it's okay where you are right now. And then you need to realize that you're making the choice and you're choosing the consequences.
I like that. So let's talk about some herbs for obesity.
Yeah, for sure. Well, let's just talk about two things. Probiotics. Let's talk about probiotics. These two, I think, go hand in hand. And berberine. So berberine is actually a nutrient within a lot of herbals that we use. We have
So these ingredients we've listed this entire podcast, they're like woven into many of the herbals that you make here.
That I make and that we put together here, yeah. And so berberine and probiotics. So probiotics, proper gut bacteria, right? There's a variety of different biotic species that actually determine what hormones we release, what vitamins we produce, because we actually produce vitamins in our gut, bacteria do. And also it will influence our blood, it can thin our blood, it can thicken our blood. So it's really, really important that we are supporting our body with these natural herbals. So berberine, let's talk about this. Berberine has actually been compared to the GLP-1 agonist. Remember the GLP-1 agonist, when I say that...
Ozempic,
Wegovy, semaglutide, these type of metformin, right? These type of medications that people are taking or on, these could be diabetes. These are diabetes type medications, right? And so they help with blood sugar regulation, but really what they do is they help as a GLP-1 agonist, which means that they're going to help with the receiving of insulin almost at the muscle layer. But GLP-1 is actually produced and secreted by specific bacteria. The signaling comes from bacteria within the gut. And if you're missing those bacteria, then you don't signal for that release.
Okay.
So you need appropriate amount of probiotics. So take probiotics, find a good blend, go to your natural care provider, get the probiotics that he recommends, and then start taking berberine. Start taking berberine according to the recommendations that your care provider gives you.
So you're not just saying go to the store and buy this. You want people to find their healthcare provider.
If they want to be successful, you should get the recommendation of a professional who uses these substances frequently.
Because I tried doing it on my own.
Yeah.
We all have.
Sure.
You go to the natural food store and you try to buy organic and you try to exercise and eat healthy, and sometimes it's just like, I need to get my blood tested, analyzed by someone who knows what they're doing. And so you've helped me a lot. I hope other folks get encouraged by this too. It's just, I know you want out there, if you're still listening, something that is plug and play. I desperately want that in every aspect of my life, but you got to kind of pay the piper. You got to like go to somebody who knows what they're doing, right?
Well, yeah. I mean, you've got to check in.
How much can you do on your own though? And the supplements and the fish oil and the and the CoQ10 and you hear about all these things and you just want to go out and buy them and like live your life.
So really what you're speaking to, Nick, is that I have dedicated my life.
My laziness.
I've dedicated my life to this.
Yes.
Right. I've studied it for years, and there are many other doctors that have as well. I know that the term expert has come under scrutiny recently in our society for good reason, and it should. But there is a level of expertise to using and prescribing herbals. And in our culture, people often look at it and they say, oh, vitamin C, yeah, we can do this. Oh, I do a little bit of that. I do a little bit of this. No, we're talking about medicine. When I practice herbals, I'm talking about medicine. I'm talking about having a physiological change that I'm going to actually see on blood work. I'm not just talking about ho-hum, whatever, right? Again, the prevention of some of these diseases can be to where you're just taking some of these things 2 to 4 times a week. And you're just trying to get some of these things. Sure, that's going to help prevent a lot of these things. And if you're doing it over a long enough period of time, it's going to prevent a lot of these diseases from developing 100%, right? But then if you've gotten yourself into a pattern where you've already developed one of these conditions, right? One of these chronic diseases, then what's going to happen is you're not going to be able to fully overcome that without the direction, in my opinion, of a professional care provider.
Well, if they want to reach out to you, how can they do it?
Well, you can reach out to us on our website at chwheber.com, or you can reach out to us at our office by calling our phone number. You can reach out to us to see our website. Call us at our number here. 435-657-3696 is our number.
And you offer virtual consults as well if folks aren't.
We do virtual consults, yep.
Utah. All right, everybody.
Thank you for joining in. There was a little stutter on the end there.
Yeah, I double punch.
Oh, it's all right.
It's a double punch. Be well now, everybody. Comment below. What do you want to see? What do you want to see? What do you want to listen to? Subscribe. But please do give us ideas. Like, what do you want us to talk about?
Well, let's end chronic disease in 2025.
Let's do it.
Let's do it.
Sounds like a great idea. All right. Namaste.
Namaste.